Technology is advancing. We have adopted AI and even robotic surgery. But what about vision? What is the latest in it? Hello and welcome. I'm Nutan Manohar. On behalf of Times of India and Star Surgical, it's my pleasure to build awareness about the latest in vision, and that's implantable contact lenses, through a discussion with highly sought after experts. At some point in age, all of us squint and find the world a bit blurry. Unfortunately, for many of us, this is a reality at a younger age too. But now, imagine a life where you can wake up in the morning with good vision without the hassle of glasses or contacts. This dream is now becoming a reality thanks to various refractive procedures and revolutionary technology such as the implantable contact lenses. As cutting-edge alternative to laser vision correction, ICLs offer a dependable and effective solution for those seeking clearer vision. And in this chat, we will explore vision without boundaries, embracing advances in eye care technology. And for this discussion, we have two experts. We have with us Dr. Shreyas Ramamurthy. Dr. Shreyas Ramamurthy is the Managing Director and Senior Consultant specializing in cornea, cataract, and refractive services at the Eye Foundation in Coimbatore. He holds an MBBS from Coimbatore Medical College and an MS in ophthalmology from Aravind Eye Hospital in Madurai, where he has been awarded a gold medal for his exceptional performance. He further distinguished himself by completing his FICO certification, placing him in the top 1 percentile. Dr. Ramamurthy has received numerous accolades, including gold medal for contributions in subspecialty at IIRSI and for corneal refractive surgery at the NIO meet in Pune. His expertise spans advanced refractive procedures, including topo-modified contura, LASIK, and SMILE. And he has an impressive record of 34 major publications in peer-reviewed journals. Thank you, Doctor, for joining us.
Thank you. Thank you so much for having me over. Thank you.
And we also have with us Dr. D. Ramamurthy. Dr. D. Ramamurthy is the chairman of the Eye Foundation, a chain of tertiary care eye hospitals across South India. He completed his MBBS at JIPMER, Pondicherry, and his MD in ophthalmology at RP Center, AIMS, New Delhi. He holds a DNB in ophthalmology and a fellowship in vitreoretinal surgery. Dr. Ramamurthy has served in prestigious positions, including the president of All India Ophthalmologic Society and chairman of its scientific community. He has won numerous awards, including the American Academy of Ophthalmology Achievement Award. He has delivered over 27 named orations in India and abroad and has 63 publications in peer-reviewed journals to his credit. He's always also been invited as speaker to various international ophthalmologic conferences and has performed live surgeries globally. Thank you, Doctor. It's an honor to have you with us.
My pleasure entirely. Thank you.
With that, I'd like to dive right into the questions. Dr. Shreyas, what are some common reasons you have encountered for people hesitating to opt for vision correction procedures?
I think more and more as the decades are passing by, we are seeing a greater adoption of patients wanting to have glass and contact lens free vision. And so the numbers overall of people seeking such procedures is going up worldwide. Having said that, for your specific question, that some of the reasons why they may be hesitating to undergo the procedure is very often that patients have certain worries or concerns regarding the fact about the stability of the overall correction that they get, whether the power is going to come back, whether they will remain glass free over a period of time, whether they will have the same quality of vision that they had with glasses or contact lenses, or whether the quality of vision would suffer. And the third being perceived concern about dry eye after certain laser vision correction procedures, which can also hamper their quality of life. These are possibly the three major concerns why patients have some concern regarding undergoing laser vision correction procedures.
Thank you, Dr. Shreyas. Dr. D. Ramamurthy, how do advancements in technology, for instance, ICL, change the approach to treating long-standing vision issues?
I think these are offering permanent solutions to the vision problems of our patients. ICL, it has several iterations and there have been several advances that have taken place. Now it's reached a level of perfection as far as the material, the concept, the design of the lens is concerned, so that once placed in the eye, it's able to take care of even extremes of power, whether it's hyperopic, that is plus power or minus power or astigmatism, and now even presbyopia, need for glasses for reading in a very permanent manner. And one of the good things about this is that it is reversible also. So it offers the patient the confidence that just in case he or she is not comfortable with the procedure, that can also be reversed, but though it's very rarely performed.
Thank you, Dr. Ramamurthy. Dr. Shreyas, can you describe the typical patient experience with ICL surgery?
So the surgery itself is very simple. I think I'll go a little bit into what goes into preparing for the surgery. Essentially, these can be done for any refractive error. And that's one of the main advantages. You can even go for very high refractive errors, high powers, which cannot be corrected very comfortably with laser vision correction. These patients usually undergo a preoperative checkup where a detailed power assessment is done, various scans of their eye and measurements are done. And then specific measurements attaining to the sizing of the lens is also performed. And once these measurements are done, the lens specific for their eye, for their power, the customized lens is then ordered. And it could take anywhere between 1 to 3 weeks based on the type of lens that we are ordering for the lens to the lens that we ordered to come back, and then we can schedule the surgery. The surgery itself is a very quick procedure where essentially the lens is tucked into a place called the ciliary sulcus, which is just behind the iris, and the patients regain clear vision from the very next day itself. Even the amount of discomfort, irritation, pain all goes away from day one, and they will be able to continue with all their regular activities from almost the first day after surgery.
So I think compared to the points of discussions that you had earlier, especially on laser-based surgeries, etc., it seems to be offering especially ICL seems to be offering a much better quality of life after the surgery as well. Would you like to elaborate on that?
So immediate post-op, I think both sets of patients, even after laser, especially the more advanced laser procedures, they would also be comfortable and they would have good vision. I think where phakic intraocular lenses score over laser vision correction procedures is essentially we are not making any anatomical change to the eye. So in laser vision correction, we are changing the shape of the cornea. And because we're changing the shape of the cornea, there is a certain healing process which happens. And especially when we correct higher powers, they can have something called regression, or a low amount of power can come back. Whereas with a phakic intraocular lens, it's a much more physiological in the sense that we are not really changing the anatomy of the eye. We're just placing an additional lens which corrects the refractive error, and that remains stable for several years. And it's a potentially reversible procedure. Essentially, the lens we place in, though we are not really looking to reverse it, but if we want to, we can remove it and the patient goes back to the previous state, which is not possible with laser vision corrections. With regard to the quality of vision, essentially these patients we can treat what we call a wider optic zone. That is, the patient will have a vision which mimics more that of a natural vision, what a normal person has, with a very wide optic zone, wide field of vision. And additionally, what the lens also does is, because it's very close to what we call the nodal point of the eye, that is very close to the center of the eye, these lenses do not cause any minification or magnification. That is, with the high minus powered glasses, all objects can appear minified when a person is wearing a high minus powered glasses. Whereas this will, because it's close to the nodal point of the eye, it gives a image which is very similar to that of what a normal person sees. And therefore, the quality of vision that a patient gets after this procedure is also very similar to that of what we call a emmetropic patient, or a person who does not have any refractive error.
Thank you so much, Dr. Shreyas. Dr. Ramamurthy, here I want to ask you about patient experiences. Can you share a couple of life stories or experiences of patients after ICL?
I think, there are several such examples. It's, there is a perception that refractive surgery is a cosmetic surgery, which I feel is completely wrong in the sense that, it goes much beyond just removal of glasses. It's a life-changing procedure where it is not just independence from glasses or better vision without glasses, but it is which changes the character, the outlook of the patient entirely. And especially ICLs addresses not patients with -2, -3 diopters of power, but it is capable of addressing people with -15, +6, +7 diopters in for which we thought there was, which is beyond the realms of what laser vision correction can do. So there have been several patients of mine. I can recount a young girl who came way back in 2007 when I just started performing ICLs, who had been having a power of about -16, and she has gone around to multiple hospitals looking for a permanent refractive correction. And because at that point of time, laser vision correction was only popular. So most surgeons examined her, and rightly so. They said that nothing much is possible for her. She has to live with contact lens or glasses. Unfortunately, she was not quite comfortable with her contact lenses. She was just 22, and she had to, you can see, think of wearing a -16 thick glasses socially, even professionally. It was a huge handicap for her. So now she came, and that time I just started gaining confidence with phakic intraocular lenses, and that is ICLs. And I went ahead and performed in both eyes. Today we do it both eyes simultaneously on the same day. Since there was early days for me, I did one eye, and 3 days later, she was quite happy, especially with the intervening period. It was quite a contrast for her, what she was experiencing in one eye and what she was seeing in the other eye. And once I did it for her in the other eye, it was a completely life-changing experience for her. And what she found was that, all along, it was not just for her, but for the entire family. They thought they have to bear with the bugbear of wearing these thick glasses right through, which was so disabling for her. But once she achieved this freedom, and not only was it freedom from glasses, as Shreyash mentioned, because the minification effect of the highly concave lenses has been done away with, her quantity of vision also improved, her quality of vision improved. So she still comes to me. She is settled in Europe now, married and nice, well settled, doing very well professionally. Every time she visits India, she drops in for a checkup, and she is highly thankful to us for what ICL enabled us to offer her. And you wanted something more recent, and there was a 45-year-old gentleman who thought whose young daughter had just undergone a laser vision correction with us, and she was very happy with that. He said, "What about me? I mean, can I get something done?" But he has it here, power about +1.5, another 1.5 for reading. So that's though there are options available, laser vision correction, the quality of vision, the options are not so great. Now, very recently, the ICL has come up with that EDOF version, the extended depth of focus lenses, so that it's not just the power, but the reading vision is also taken care of. And we went ahead and offered these lenses for this gentleman, so that bilaterally implanted, it was not just the need for distance, but also for reading, he could be taken care of quite comfortably.
Thank you, Dr. Ramamurthy. Any cases where the patient is much older?
In the sense that, what we generally do is once the patient is beyond 50 or so, because that's the time when cataracts can come in a few years' time, we generally stay away from implanting these lenses, because, we implant these lenses in a few years, the patient develops a cataract. It's a second procedure that needs to be done. Earlier, we were staying away from doing it even beyond 35, 37, because the presbyopia used to come in, and that used to require reading glasses. Now, with the availability of the EDOF lenses, we are able to address both these. So generally, our cutoff is around 48, 50, up to which we offer these lenses.
Thank you, Dr. Ramamurthy. I mean, those are really inspiring stories. And, even as you say, recollect those stories, there's a smile on your face. It shows how deeply satisfying the work has been. So thank you so much, Dr. Ramamurthy. At this point, Dr. Shreyas, what would you say to someone who is hesitant about vision correction procedures in general and specific to ICL procedures because they fear it's too complicated or too invasive? So, and I'm sure this is the case with almost every patient that comes to you. So, how do you help them understand this?
I think that's where some of these awareness programs really help because very often patients of a younger age group, 20s, 30s, have heard of the terminology of LASIK or know the word LASIK and come asking for LASIK surgery or LASIK procedures. So when we tell them that possibly one of the varieties, one of the iterations of LASIK is not the best option for them, and we have to implant a lens in their eye, because that usually they relate to cataract surgery where the natural lens is removed and another lens is placed. So I think it's the intraocular nature of the procedure that usually worries them. But overall, this is definitely a very, very safe procedure. So there's really no reason why a person should hesitate to undergo a phakic IOL surgery or ICL surgery. And by all means, as long as they fulfill the criteria required for the surgery, they can definitely go ahead and get the surgery done.
Thank you, Doctor. And actually, something that you mentioned earlier on also was that, when you do ICLs, you're not changing the anatomy, the shape of the eyeball, which on the contrary, with LASIK and laser surgeries, you have to do. So I think it's a matter of just becoming educated about, what is good for your eye. Doctor, are there any complications if people don't take care of their eye problems? Because I think in your 40s, everybody will start having issues, presbyopia. So, it becomes very difficult to read your book and to see your screen. But many of us would, prefer to leave it aside, imagine that it's part of life. But is there a problem if you do that?
Is there a problem if you don't wear presbyopia correcting glasses?
Yes.
I mean, it's not a problem per se. It's just that the strain is going to be there, that you would not be able to read very well. Usually in the early 40s, the problem is with reading fine print, something which you would see in a newspaper. Again, the reading difficulty is more when the lighting is dim. So essentially, if you are working in a bright lit office, most of your consumption is on a computer screen or an iPad, where you can enlarge the font as well. You have a good background illumination. Then generally you're able to avoid glasses for much longer, possibly even up to the late 40s, up to 50. But beyond that, definitely it becomes much more difficult and you would definitely require glasses. Having said all this, I don't see any reason to hesitate to either start wearing presbyopic glasses, progressive glasses, or undergo any of these procedures which correct presbyopia even at that age. So definitely there is a level of discomfort which a patient has to undergo if they are not using these glasses or undergoing any procedures to correct presbyopia.
Thank you, Dr. Shreyas. I mean, that was in detail as such. Thank you so much. I mean, I have to thank both of you, Dr. D. Ramamurthy and Dr. Shreyas Ramamurthy. Thank you so much for taking time out to help us understand more about ICL. You've helped us with, insights into vision without boundaries, embracing advances in eye care technology. Because while as a human being, you're embracing a lot of technology and lot of advancements, when it comes to vision, people tend to be a bit slow about it. So thank you so much. And on behalf of Times of India and Star Surgical, I wish you happiness and success.
Thank you so much. Thanks for having us over.
Thank you, Doctor. Thank you so much.